Hey everyone, welcome. I am Dr. Jason Pape, chiropractic extraordinaire, giving you education, information, motivation, inspiration on the regular right here for our podcast. We've been doing this for a long time on Facebook and Facebook Lives, but now we're doing full-on podcasts. So here you are. Hopefully you're watching this and getting some good information. As always, if you think this is something that might help you or someone else, like, subscribe, share, all the things. Hit that button and just like and subscribe. It would be really great. Anyway, so today we're going to talk about dispelling a lot of the myths around chiropractic. So first of all, I am a chiropractor, functional medicine practitioner. And there's a lot of myths out there about chiropractic, what it is, our training, all these kinds of things. So I'm going to kind of address them in this video here so we can kind of give you guys some better information about what's true and not some things you hear on some TikTok influencer or some comment in a troll is leaving for you, so you can truly understand what's going on here. And then listen, what are the benefits of coming to see the chiropractor? And then also that just like any other profession or many other things out there, there's different levels of what something can be within that same title. So first of all, let's address the first big elephant in the room that, hey, chiropractors aren't real doctors, or chiropractors are quacks, or voodoo doctors, or witch doctors, all this kind of crap you hear. Or we don't have any real training. I think I'll call Joe Rogan out right now. I'm sure he'll care. Someone said Joe Rogan was out there saying, oh, chiropractors don't really have any good training. They only like 6 months certificate. None of that is true. So let's just talk about our background, our training. So following undergrad, it is a 5-year program, chiropractic. That's usually done most of the time you're going year round. So for me, where I went to school, we did trimesters. We had 3 trimesters a year, 15 weeks each. And we did it over 3 1/3 years. So, if you did your college, instead of taking summers off in 4 years, you would have done it in probably 2.5. All right. So a 5-year program, 10 trimesters done in 3 1/3 years. That's how some of the schools do quarters. Either way, it went up to the same amount of training. So first of all, after undergrad, you're getting a ton of postgraduate work. Traditional medical school is about 3 years, and they go and do all the residency and everything else. So there's not much different there. And if you look at our training compared to medical schools, they're about the same. There's a couple of differences. One of the biggest differences is that actually we as chiropractors have 100 hours more of gross anatomy than medical doctors. Whether you can believe that or not, that is the truth. Now, where they get pharmacology training, we're getting training in chiropractic adjustments and philosophy. Those are the big differences. There are a couple of smaller differences here and there, but in general, that's it. So when you look at what they come out of med school with, what we come out of chiropractic school with, our basic understanding of the human body is the same. We have better gross anatomy understanding. We can adjust the spine. We have a little more focus on the spine. They're more in pharmacology. And here's a drug that fixes this. Now, that being said, they go off and do residency and all those kinds of things. And yeah, they might get some more gross, anatomy because they're in there if they're surgical or something like that. But in general, our basic training is about the same. So when you say you're not going to a real doctor, well, that's not true. You're going to a real doctor. We can diagnose, all right, just like anyone else. We can write blood work scripts. We can write x-ray scripts. We can do all the things that the medical doctor does. The only different thing we can't do is prescribe medication. And to be honest with you, we don't want to, because we are holistic doctors and we look at the whole of the body. So now our philosophies are a little different. We'll go into that in a minute. But that's the big difference. So when people say, oh, you're not a real doctor, that's not true. We are just as real a doctor as your medical doctor, your DO, and probably even more of a real doctor than your dentist and your podiatrist. Not that there's anything wrong with those doctors. And definitely much more than a physical therapist or a doctor of physical therapy. Again, not knocking them. They're great at what they do, but those are different levels of the doctor world, if you will. And then when you talk about things like PhDs and Jill Biden type doctors, those are not doctors at all. They're just doctorate, they're educational doctorates, if you will. Okay. And technically even a lawyer is a juris doctor. That's why it's interesting. So lawyers, they get a JD, a juris doctorate. They are doctors. And when they're practicing, they can't call themselves doctors. When they go out, if they go to teach and they're not practicing anymore, they can be Dr. So-and-so. So my sister, my dad, they're both, my dad is now passed, but they were both lawyers. But if they decided to not be practicing anymore, went out in there and were teaching in law school, they could be Dr. Pape as well. So there's some things to understand. All right. So we do have a lot of training. Now, when you look at allopathic versus holistic medicine, they're very different. Allopathic, or your Western medicine, your traditional medical model, is very different than holistic model, where we're looking at the whole body and how everything works together versus looking at specific systems, right? When you go into traditional medicine, there's a lot of specialties. And you're a general practitioner, but a lot of specialties. When you look at chiropractic, we are kind of look at the whole picture of how everything works together. That's really the bigger difference going on there. Now, that doesn't mean all chiropractors are equal. It doesn't mean all medical doctors are equal. And we'll talk about that a little bit more later. But that should hopefully dispel some of the myths around the training. You can go research. This is all valid stuff that's right out there for you to find. Then we talk about the danger. People say, oh, it's dangerous. Don't go to the chiropractor. He's dangerous. They could, they're cracking your bones. They may break your neck. They're going to cause a stroke. They're going to paralyze you. Okay, so all that's just some BS. So first, let's talk about that crack. All right, we're not cracking anyone's bones or backs. All right, with a traditional manual manipulation or adjustment, all right, there can be that sound of a crack, if you will, or a pop. What that is called a cavitation, and that is really gas collapsing into solution. Someone said to me, oh, you're releasing CO2 from a joint. No, that's not actually what's happening. Is that most joints in the body are these fluid-filled synovial joints, okay? And they're a closed system, and they have a fluid in them called synovial fluid. Within that fluid, sometimes we can get these bubbles that can pop around in fluid, just like anything else can have bubbles within fluid. But when you do the traditional manual manipulation, you bring a joint through a full range of motion, and you put a small force and bring it into the paraphysiological space. All right. So you bring it to an end range of motion, put a small force, we call that chiropractic adjustment. That kind of resets and recalibrates that joint to free up better motion. When that happens, that pressure change within the joint causes those bubbles to kind of collapse into solution, hence the popping sound. All right. And then it takes about 20 minutes or so for those bubbles to recoalesce. So that really just understand that popping sound, that cavitation, joint cavitation is what it's called, is secondary to the adjustment and not necessary for the adjustment. So it is a side effect, if you will, is that noise. So if I were to crack my knuckles, there you go, hear the little crack there. That's the same thing I'd be doing by working on your neck, your back, your mid-back, whatever, with a manual adjustment. But I can't do it again because I just cracked them. So all those gases have now popped into solution, and now it's going to take a little while to coalesce. So when you crack your own back, you get that crack sound, and then you can't do it for a little while. Then 20 minutes later, you can do it. I feel a little better. And then 20 minutes later, I got to do it again because you haven't really fixed the problem. We'll talk more about that in a minute. But that is a side effect. In fact, they did studies with this where they actually did the cavitation without the actual adjustment, the manipulative force, and they found no effect. When you added the adjustment part with or without cavitation, it made a change. It's not always about the noise, it's about the movement. But that's what the crack is. We're not cracking someone's bones. We're not breaking anything. And listen, I can't just break someone's neck. You would have to really try to break someone's neck. And even then, good luck. If you've seen too many Steven Seagal movies, all you're seeing is someone give a really bad chiropractic adjustment. He's not breaking anyone's neck. But yes, no chiropractor is going to break your back, break your neck, paralyze you. Now, if you had fallen down the stairs and fractured your spine and didn't know it, and then someone adjusted your neck or back, maybe then something could happen because you had a fractured vertebra. But no one's walking in your office like that. And if they are, and they had that kind of history, you would get x-rays first before you ever touch them. Okay? So hopefully that helps dispel part of that, March. And then there's the stroke risk. All right. So let's address this elephant in the room. So this is a spine. All right? And within the cervical spine, my spine has seen better days. Not my spine, but this spine. I've had this from chiropractic school over 30 years. So within the spine runs something called the vertebral artery. All right. So the carotid arteries, your common carotid comes up here. It splits into your internal and external carotids. Off those, the internal comes your vertebral artery, which goes in your neck and then into the brain part of your circle of Willis, which is the thing that perfuses your whole brain with blood. You have two sides. And you have collateral circulation. So basically, the circle of Willis, which is the blood vessels that feed the entire brain, the main complex that we call it, has two different sides that feed it. So God forbid one side is closed down, the other side can still perfuse it, and you're okay. All right, it's a redundancy there on purpose. Because if you only had one way in and something happened, you wouldn't have any blood flow and you'd stroke out and die. When someone gets a chiropractic adjustment, if done improperly, we'll talk about what that means, there can be a time where you can cause a vasospasm in the neck and in that vertebral artery and temporarily close it down. If you already had some closing down to the other side and you did that temporarily, that could cause a problem. So basically the risk of a stroke from a chiropractic adjustment, when done improperly, is about 1 in 2 million. All right. And that is putting someone's neck in extension and rotation. So you should never adjust someone's neck in extension and rotation, because that is more likely to close that vessel down. And again, you always screen your patient before you do manual manipulation. Do they have a history of cardiovascular disease? Or do they have issue with their family, with or personal or familial, or of heart disease or stroke? Are they on birth control? Are they a smoker? Are they a smoker while on birth control? Those are the kind of questions you want to find out, as well as doing certain orthopedic tests that tell us there's more likely to be an issue, like a George's test. Okay? Now, what's more likely to give you a stroke? Adjusting your own neck. Most people, it's one thing if you do this and your neck cracks, but most people, if they crack their own necks, what do? They put themselves like this and they crack on their own neck. Never do this. All right? Extension and rotation. You're more likely to cause yourself a stroke doing that to yourself, or going to the hairdresser and putting your neck back into that sink where they rub and do your head, than ever what the chiropractor is going to do for you. And I personally, if I know someone, I'm an activator chiropractor. We'll talk about that more in a minute. I do manual, but this is my main form of chiropractic. I can't cause a stroke with this. Can't hurt someone with this unless I throw it at you, maybe then. But I don't throw this at my patient, because I'm not putting through that range of motion where I could ever cause a vasospasm or any kind of problem in the vertebral artery. But I digress. But when those patients that I do manual, if you crack your own neck, I'll never touch you. I'll never manually adjust your neck. You know why? I'll use the activator. I would never manually, because you know what? You'll crack your neck all day long, and then you'll go blame the chiropractor when, God forbid, something happens when you're cracking your own neck, causing your stroke. All right? So understand that you're more likely to hurt yourself doing this to yourself than anyone is ever going to do it, or getting your hair done at the hairdresser. Now, if you think about traditional medicine, so people think, well, I don't ever want to take that risk anyway, that 1 in 2 million, that's too high for me. Okay. So just so you know, the number 3 cause of death in this country is medical mistake. Whether it's an error in medical practice, whether it's giving you the wrong drug, the wrong dose, surgery gone wrong, something, or even just things that happen within surgery, or medical interaction. Meaning, just so you know, any 2 drugs, 2 medications, there's an 80% chance of interaction. All right, and interaction is not a good thing. So people on 2, 3, 4, 5, 6, 7, 8 meds, and you don't think they're interacting, causing problems, you're more like the equivalent of people that die from medical mistake every day is like 2 Boeing 747s full of patients filling people, crashing into each other every day. So that's a higher risk. Taking your drug, your statin and your whatever other drug they're putting you on, your pressure meds and something else, to ever kill you than the chiropractic adjustment done by a properly trained chiropractor who assesses the risk factor. So no, we're not killing you. We're not paralyzing you. We're not causing a stroke. Does that mean it couldn't possibly happen? Sure. But to the level of anything else ever happened to you? No. Sorry, it just doesn't work like that. So as we go through, people talk about chiropractic adjustment being painful. Listen, when you walk in with an acute pain or spasm, yes, the proposition of having something twisted or turned might be uncomfortable. But what we do is not a painful technique, and it can be some discomfort, especially if you're adjusting someone who's has some actual spasm or inflammation. But it's interesting, when you actually palpate a spine, a lot of times you find a very painful spinous process, this part of the back of your spine here. It's because that area is subluxated. So it could be a little sore. Why is there pain there? Well, because things aren't moving properly, causing localized spasm and inflammation. And we're finding that sore spot, and we have to sometimes work through that. Now, the nice thing about the activator, again, I can't hurt you with this. And sometimes unless someone has a really super inflamed area, they're not going to feel much while we do this. So chiropractic does not have to be painful, and it doesn't mean it is painful. Everyone has their own pain thresholds, but it's not true. That's another kind of misnomer. And one of the things we want to talk about too is, we get into this, is about research. There's no research behind it, or it's not a researched or real profession because there's no real research. That's all BS. So first of all, understand that most research is paid for by things that make it money, meaning pharmaceutical companies, things like that. A lot of medical research is paid for because there's something to go there, or they're getting grants from the government. And a lot of that's all based on the medical establishment, which is very ingrained everything in. All right, traditional medicine, your pharmaceutical companies, and your insurance companies are all like this. All right. And it's not a conspiracy theory. It's really literally what it is. But that's where the money comes from. Why the funding is there. So that's why there's a lot more research there than there is. But there's a lot of chiropractic research going back 40, 50 years at this point. The fact is there was not a lot of money putting into it to do the research. Right? There's more and more now, but we've had to kind of do our own funding because there's no money in it otherwise for traditional places to do this kind of research. But there's a ton of research out there. To say there's none is just ridiculous and ignorant, actually. In fact, one of the earlier pioneers of research for chiropractic in the 80s was Activator, doing research and showing that this thing actually effectively moves and resets that joint just like manual manipulation does. So go out there, look up a lot of stuff. Heidi Havik is another great person doing a lot of amazing research in the chiropractic space out of New Zealand, showing all the benefits, efficacy of chiropractic on the brain, on the immune system, and all these amazing things. So David, look into her research. There's a lot of other things out there. There's tons of research, both on adults and on children. Go look. All right. So to say there's no research is just honestly just ignorant. You can go out there, look in PubMed and other things, and you'll find tons of research articles that are well documented and well established. And the best part is because other professions sometimes do manipulative things as well, you'll see other things showing up in their research too. So it's out there. Look at the osteopathic manipulation is another one, things like that. So it's there. We talk about once you go, you got to go forever. All right, we'll come back to that one actually now that I think about it, because that's something a little bit more about talking about the benefits of chiropractic. We'll talk about children. Not for children, or it's experimental for children. None of that's true. The fact is, your nervous system is developing from the day you're created in the womb throughout your gestational time of pregnancy, and then from then on until you hit 18, 20 years old, when your body starts to kind of hit that final maturity before it hits that plateau. So as we age and as more things happen to us, we load more onto our bodies and that wear and tear and things like that. So I can help a developing nervous system much better than a developed nervous system. Does that make sense? So if I can get to a problem early, 1 year old, 2 years old, whenever, versus a 30-year-old, well, things that might have been a problem for you when you were 2 or 5, 8, if we had addressed them then, you're not paying for it at 30. Once that nervous system's kind of set and your body's, you've matured, all those things and all those wear and tear, it's very hard to go back. All right. We can definitely do much more the younger we start. All right. So what we do is very gentle. There's a lot of great benefits to in both research as well as, anecdotally, if you want to talk about what we see in practice, the benefits of chiropractic care. And nowadays, a good pediatric chiropractor like myself is evaluating these kids throughout development, the first year to 2 years of life, making sure we hit milestones better than the pediatricians are doing. A lot of pediatricians are not even doing much more milestones, except maybe when are they walking, when are they talking, when are they crawling. And nowadays, they don't even care if they crawl, which is ridiculous. So important. I have plenty of patients that walk in and I talk to them about why they should, what goes on, the benefits of chiropractic from childhood on, as well as all the things we're going to talk about on a developmental step from milestones and how that can affect the developing nervous system and how we can help with that along the way. And these are things that they never talk about by their pediatrician. Or I'm asking them questions that, an 8-year-old, a 5-year-old, whatever, that may have some developmental delays, learning disabilities, whatever they may be. And I start asking questions about them, they don't remember. That's fair. I don't expect someone to go back 3 kids in and remember what kid number 1 did, with how old they were when they walked or crawled, did they roll, whatever. But they didn't know to look for these things because no one talked about it from the pediatric standpoint. So sometimes you're going to get better support for development of your child with the chiropractor than you will the pediatrician. Not saying the pediatricians aren't good doctors, but a lot of pediatricians, it's more about, are they hitting their growth chart milestones? are there all obvious developmental delays when you're coming for your next vaccine, and here's your drug when your kid's got an ear infection? We're a little bit different. And we'll talk about that whole having to go forever thing in a minute, because that also ties into the children aspect. But the last thing I want to talk about is that we're back pain only back doctors. Again, not really the case. Your spine is where your spinal cord is housed, right? So let's talk about chiropractic in general, right? What is it? How does it work? So your brain and body communicate through your spinal cord, right? The spinal cord is that highway, that main communication system from the brain and the body. And it's housed in your spine. Your spine is just a series of bones that all sit on top of each other, and they all move. They all have a range of motion, and every segment a nerve exits. And that nerve goes everywhere. It goes to your muscles, your skin, your organs, your immune system. And there's a constant flow of information back and forth. This is the highway. This is the conduit of information from body to brain and brain to body. And when things aren't moving the way they should in this area, it can affect that communication highway and affect function. Our job as a chiropractor is to find that area of misalignment or subluxation restriction and restore normal motion by putting a small force into the spine to restore motion in the spine to allow the brain and body to heal and communicate. Because when the brain and body can communicate optimally, the body can function at optimal capacity, and the body knows how to heal itself. The innate intelligence of the body to heal itself is there, right? Like if I cut my hand, my body knows how to heal that, right? I don't have to tell it to do it. I have to think heal to make it heal. It has an innate intelligence to know how to do it. And it knows how to make hand, not eyeball in my hand. That might be kind of cool, but that's not what it's doing. Okay? It knows this is innate intelligence, and all we have to do is to free that up to make sure it works optimally. That's what chiropractic does. And there's so much good input that goes along the spine out to distal tissues and organs and up into the brain and changes function. We see that in practice as well as in research. It's amazing what adjusting the spine can do to brain function and vice versa. Now, understanding that, yeah, if you have back pain and things aren't moving the way they should and you have localized spasm and inflammation of tissue, if we restore normal motion and we work on those tissues around it, yeah, you're going to feel less pain. So we can help the back, we can help the mid-back, we can help the jaw, we can help the head. We can work on any joint that may not be moving properly. It's subluxated. Because any joint in the body, a knee or whatever, can be subluxated and not have good motion and cause pain, inflammation, biomechanical stress. We remove those things. But we're more than just back doctors. This is our entry into your nervous system. This is how we get your brain to have good, better input and output. Better information in, better information out. Right? This is our highway. We're making sure that we're maintaining this. So when you talk about maintaining your health, you brush your teeth every day, right? I hope. You don't just wait until you have a cavity and go, oh crap, I better brush my teeth today. All right? You also don't brush your teeth once and go, woo, they're clean. Or go to the dentist once every 6 months and go, I don't have to wash my teeth again now for another 6 months because I did it. Your spine's the same thing. You work all day. Your spine is constantly moving. It does everything you do. Good luck doing anything that doesn't involve your spine in some kind of way. Standing, bending, twisting, turning, whatever it may be. Throwing, punching, kicking, running, skipping, rolling. I don't care. Your spine is involved in all of it. And it can sometimes get stuck in its motion based on the traumas and the repetitive stress we put into it through life. So you want to work on that regularly, just like you want to brush your teeth on a regular basis, just like you want to change the oil in your car regularly. You maintain your health by maintaining your spine. So when someone says, I have to go forever, no, you don't. But when you have a problem, I have to reteach you. I have to put your body back into some new places and teach you something new. The body likes what it knows, good or bad. I'm telling it to go somewhere else, and then you go back and do your thing. Because you don't get adjusted and leave my office and get cast in amber. You do things. You don't brush your teeth and never use them the rest of the day. There's no saliva being made. You're not chewing, eating, drinking, whatever, right? Your spine goes through the day and gets wear and tear on it again. So repetition early on, multiple treatments in a short period of time that teach the body to be in a better position so we can overcome the things you're doing to it in life on a regular basis, the bad postures, habits, the things you may do. Once you're doing better, most people come to me initially because they have a problem. I would love them all come for maintenance or preventative care to start. But once you're doing better, we titrate that down. And then it's like, all right, why don't you see me once every month, once every 2 weeks to maintain your spine? Why? Because you don't want to wait for a problem to occur. right? You don't want to wait for it to build up. Oh, I blew up my back. Let me go to the chiropractor now. All right. So people who do maintenance type care, okay, preventative type care, come in once a month, once every 2 weeks. And they do that to maintain their spinal health because they know that they go out to life and they do a lot of things that might misalign their spine and cause interference. And they want to function with optimal spinal health and brain communication. I find in my office, the patients who see me regularly will have less problems. They bounce back quicker when they do have a problem, and they're overall healthier. I ascribe a lot of my health to my chiropractic regimen. Like I get adjusted every week, pretty much. And I've probably been getting adjusted regularly since chiropractic school. Because you get adjusted regularly in chiropractic school, we're learning on each other, all those kinds of things. Then we leave. I worked for a chiropractor for a few years. We adjusted ourselves regularly. And ever since then, even when I have had doctors I work with, or I had a friend of mine that we've adjusted each other pretty regularly. So one of the things that I kept my health, even before I knew enough about nutrition the way I know it now, didn't understand to keep my health, is what kept me healthy for so many years and keeps me healthy now. All right. And I have found in my practice that when patients are ill or not doing well, they come in, they get adjusted. It helps them to get better. I'm not making any medical claims. I'm not saying that's what's happening, but I've seen it in my practice. Okay. So these are why people come in regularly. And this is why people come to see me as their primary, right? Because I work in a way where I'm not just a technician adjusting your spine. All right. I am your holistic primary. That's how I hold myself out. I'm not calling myself a primary doctor, so don't come and try to say I'm doing anything. Remember, I'm a doctor. I'm not your doctor, most likely. And understand that the way my patients come to me is they talk to me about health and wellness questions because I understand the body that way. A friend of mine was talking about how he's interviewing some people to be chiropractic associates for him. And he said, you know what? It's because he didn't really kind of like, the doctor he was interviewing was not at the same level that he and I are at. All right. And that's not to say that there's anything wrong with that, but this person is not playing at the same level, but they're still called doctors of chiropractic. So you may have different levels just because we both have the same degree. Doesn't mean we don't do the same things in the practice. The bases are all there. We still have the physiology, the anatomy, all those kinds of things to understand how the body works. But some are just going to adjust you, and some are going to do a lot more. So find that right doctor for what you're looking for. But at the end of the day, any chiropractor worth his weight is going to be able to properly assess and restore normal spinal function and let you function more optimally. That's really what it comes down to. Now, I've had plenty of people that have come to me before and said, oh, my so-and-so, I want my wife to come see you because I feel so great, doc. And I'm like, all right, great. But they went to a chiropractor once and they said they'd never go to a chiropractor again. They had a bad experience. Here's what I say. Most of you out there will say you like Italian food. If you don't, I get it. It's fine. I like Italian food. But I would imagine that if you like a certain type of food, say it's not Italian, and you went and had a bad Italian meal one day, you don't just give up on Italian food forever. You don't go back to that restaurant, right? There are good and bad of every type of doctor out there. There are plenty of good MDs. There are plenty of great MDs. There are plenty of crappy MDs. There are plenty of great DCs. There are plenty of crappy DCs. There are plenty of mediocre and anywhere in between. And some are all great, but some you like better than others. You have a different rapport with it. Doesn't matter. Go find a good doctor for you. But don't just think, hey, I went to this one chiropractor, it didn't help me, or maybe I didn't go long enough. Maybe are you doing what we told you to do? Did you go to the right amount of times? Did you listen to what the doctor told you? Maybe you needed a different technique. Maybe you needed a different practitioner. But to say that we're all the same is not the same thing. But this is why people go to the chiropractor regularly. This is why they go back. All right, and this is why we are different than what people think. Is we have the education behind us. We have the research behind us. We actually do have real training. We're not going to hurt you, and you are going to get well, and we can help you at all ages. So if you want to see a chiropractor, we recommend it. Go find a good one near you. If you live near me, I'm in Hauppauge on Long Island. Come find us, vitalitycenterli.com. Follow us on Instagram or TikTok or all the things. Email us, call us. All the links and information will be below or even in the video, depending on what Quinn, my producer, decides to do. But I hope this has been helpful. I hope this has made some sense, and I hope I dispelled some of those myths and let you understand all the benefits of why you should see a chiropractor. Otherwise, hopefully we'll see you in the next video, in our next podcast. Have a healthy day.